Welcome to the recorded version of Hospital to Home Preparation for Seniors, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Our presenter today is Molly Carpenter. Author, speaker, trainer, and family caregiver, Molly Carpenter brings years of personal and professional senior care experience and training to families dealing with dementia care. In her current role, Molly works with a team responsible for ensuring that the Home Instead Senior Care Network's 60,000 caregivers worldwide have the resources necessary to effectively provide quality care in the home and understand the importance of their work enhancing the lives of those they serve. Molly holds a Bachelor of Science degree in Family Science with a gerontology specialization from the University of Nebraska-Lincoln and a master's degree in education with a gerontology specialization from the University of Nebraska at Omaha. And with that, I would like to welcome our presenter for today, Molly Carpenter. Thanks for joining us, Molly.
Thank you, Steve, and thank you, everybody, for joining us today as well. I echo Steve's thanks as well. I'm just so excited every month when these webinars come up because, this series is all about family caregivers and how we can support our family caregivers on different topics, and I just love it when we get so many people to come on these webinars because it just shows me the dedication all of you are having to our family caregivers and the understanding the important role they play in their senior loved one's life. And it just gets me so excited. So thank you all for joining this call today and this webinar today. We're excited to share this topic. And on the next slide, just to give you an introduction of what we're going to cover today, we're going to talk about seniors and hospitalizations. And I'm going to approach this topic in two ways. First, we're going to talk about the importance of a good transition from hospital to home with the ultimate goal of avoiding a readmission. But we're also going to talk about senior hospitalizations from a proactive approach, which, how do we prevent them in the first place? And this is going to be key for all of our family caregivers. We recently, Home Instead Senior Care, completed a fascinating study with 400 nurses in the United States and Canada who specialize in senior care, and we talked to them about this topic of preventing senior hospitalizations. Now, I'm going to get to those results in detail in a few minutes, but one of our experts that we connected through this research was Dr. Carolyn Clevenger from Emory University, and she's the president-elect of the Gerontological Advanced Practice Nurses Association. And so you can see her quote on that slide, and you can read it. I'm not going to read it to you. And it really just illustrates why senior hospitalization is such a dangerous issue. And so I thought it was important to start today's webinar with this sort of general quote about the issue just to get us in the right frame of mind for this topic today. So on the next slide, let's take a look at our objectives for today. We're going to start by giving some information that you can share with families and seniors themselves and about how to have a successful transition from the hospital to home, as well as how to prevent those unnecessary hospitalizations. And we're going to talk about the barriers that could put an older adult at risk for hospitalization. We're going to discuss 5 key and important ways to keep seniors out of the hospital, which are very similar to avoiding a readmission. So we'll talk about all that a little bit later. And lastly, of course, I love to provide you with lots of tips and resources that you can share with families and seniors on how to keep them safe and healthy at home after they've returned to the hospital, and even, again, to avoid them going into the hospital in the first place. So as usual, we will share all those resources at the end. So I want to start with readmissions. So on the next slide, let's talk about why readmissions occur. Now, there's a couple of big reasons, and one is that patients may be discharged without fully understanding their illnesses. Here is where that family caregiver is such an important part of the process. Illnesses are usually complex, right? A person doesn't get discharged with one set of instructions. For example, just check your blood sugar and you'll be fine. The instructions are usually so thorough and they're detailed explanations that it's all such great information. And it's all these explanations on how to cope with the illness that landed them in the hospital in the first place. Sometimes it's hard to understand everything, especially when something is new or when an illness or chronic condition has become more complicated. Now, the other reason, kind of a big reason why readmissions can occur is that when a person has a chronic condition, they've had it for a while, and the care staff may assume that they know how to already deal and cope with their condition. So sometimes there's a confusion about, well, this person's had diabetes for years. Surely they know how to care for themselves. And we get to this role of, I don't have to cover everything. And, sometimes that's true, and sometimes it's not true. And I can share a great example with you all with my own grandmother. I talk about her a lot. She did have chronic heart failure, which she had for many years, and it progressed naturally over time. And as a lot of you know, that's one of those chronic conditions that's kind of an up and down roller coaster of conditions. One day it's fine, everything's fine, and then there's a huge setback, and then typically she could bounce back again in a few weeks or months, however long it took. And she knew her heart was not 100%. For a lot of years she knew that, But with each instance, when there was a flare-up or a change of the condition, she had to get used to and figure out how to cope with the changes that the disease brought. And one of the toughest parts about it was the use of that diuretic pill or the water pill. It was always a challenge for her to manage. Now, because she was on and off of them so much, the staff always, not always, but they thought that she knew how to manage these, and they knew the importance of taking them. And a lot of times she would even give an indication to the care staff, to the discharge planners and the nurses, like, okay, I know how to do the water pill. So it's lots of times the patient saying it, but she would say, I know how to do it. Well, she didn't always know, especially as the disease progressed. She would ask her daughter, my mother, who luckily is an RN, and she would ask about the instructions. She would call a lot, make sure she was taking them right. And then as my grandmother got older and a little bit of confusion set in and just a little bit more frail, those instructions were harder and harder to remember and harder to keep up with, and lots of complications there. So, having an RN daughter, a nurse that's a daughter, is something we can't always count on. So, but the importance of reducing that fluid in a patient with chronic heart failure is crucial. And if it's not handled properly, it can lead to a readmission. So just one of those, when you think about why these readmissions can occur, it's the patient, saying, oh, I know how to do this, I know how to manage that, or it's the care staff, oh, they've had diabetes for years, they know how to do it. So that's sometimes which can lead to these readmission situations. So there's some additional reasons, though, why readmissions can occur. Let's look at those on the next slide. And no surprise to most of you on this webinar, it's medications. Medication management is one of the leading problems that can send a senior back to the hospital. In fact, according to the Centers for Disease Control and Prevention, adverse drug events cause over 700,000 emergency department visits each year, and nearly 120,000 of those patients are hospitalized for further treatments. That fact just floors me every time I read it or think about it. Now, sometimes patients, what happens is they inadvertently discontinue important medications needed to stay well and needed to manage their disease. And I go right back to the diuretic in my grandma. After a few days, she wanted to be done with those water pills for obvious reasons. Now, of course, we monitor her closely and kept reminding her of the importance, but that's just one example of why patients sometimes just stop taking medicines. They don't like how it makes them feel, and they just don't want to do it anymore, and they think they'll be fine, that the medication cured them for a few days, and that's all they needed. The other thing is that maybe a medication changed in the hospital, and there could be confusion among the family physician, whatever they're prescribing. It might conflict with another medication that was prescribed in the hospital. Again, this is where that family caregiver or other caregivers are so important during the discharge process. Another example is more of a communication challenge. Patients become confused about medications when they're changed and they're not clearly explained. And I do have an example I read about an oncology nurse in the state of Washington. She talks about how they would prescribe the generic version of Coumadin, which is warfarin, and sometimes patients would get that medication list, and they'd see that medication, and they would think, oh, well, that's not Coumadin, so they would take one of each. And, of course, that has a major impact, and it has an adverse effect from the drug. They can have an effect from the drug. So, again, the changes in medications, I know when I get prescriptions, if it's a generic, you got to take some time to really understand those generics and what everything's used for. Also, maybe the person is confused due to dementia or sometimes the side effects of surgery. This can cause a mix-up of medication. And unfortunately, sometimes money and lack of insurance, this can cause some patients not to fill medications, which, again, another potential problem that could lead to readmissions. Now, there's a few other drivers to readmission. Let's look at those on the next slide. Now, I've already mentioned, and I know all of you are so aware of this, but having family caregivers involved in the discharge planning is a major, it's an issue if they're not there, especially if they're the main caregiver. And it's not even involved in discharge planning on the day the person's leaving, but it's sort of you got to think about it from involvement throughout the whole hospital stay, because things are changing on a pretty regular basis. And they just need to be involved and up to date and understand what is happening throughout the process while they're in the hospital. There's a coordination and again, the communication, important drivers when we think about readmissions. Sometimes physicians caring for the patient, they may not communicate with each other. A lot of times there's a primary care physician and then there's a specialist. Got to make sure all of those docs are talking and they're all on the same page. And that could lead to a kind of disjointed care plan or post-discharge care plan for the person. So that can become an issue. And then sometimes patients are too embarrassed to say that they do not understand the directions that they're given. Or when we think about seniors, maybe it's the person can't hear the doctor talking to them. This was the case with my grandmother towards the later years of her life. She would kind of just laugh a little, and that was my clue that she did not hear what the person said. So she would cover it up with a little chuckle. So I would end up speaking louder and more clear to the nurse or the doctor, whoever, and re-asking the question so to signal that they needed to repeat the instructions. So there's just some things to think about when we're dealing with seniors and helping seniors in the discharge process. So you can see how important family caregivers are. And we know caregivers in general, they're all key to avoiding this readmission. So how can we help families prepare for discharge and be successful in the new situation or new care situation so that those readmissions don't occur? Let's look at those on the next slide. When we think about helping the family prepare for the transition home, asking questions and understanding the situation is such a crucial step. Now, a lot of you, if you're on the phone and you're social workers and discharge planners, you know this all too well. And in the hospital situation, you guys are the ones that are gathering all of that information and talking to families and making sure everything happens. But the rest of us that aren't exactly in that role, we can do a lot to educate families on the questions that they should ask and the information, more importantly. What information do they need to be successful for caring for somebody at home? So we need to think about, here's some areas that we can talk to families about when they're in this process. So number one, like I I kind of mentioned a little bit earlier, understanding the extent of the illness. This would involve them being around a little bit more throughout the hospital stay maybe, or at least getting updates on a regular basis from the staff. And understanding, when I say extent of the illness, even understanding how this is going to progress. Is this temporary? There's so many things when you're understanding the extent. And I know a lot of our family members, they ask this question already. They kind of want to know the prognosis of the situation. But just making sure they understand the illness is so important. And then another tip we need to tell families is really to talk about changes in abilities, what their loved one will or won't be able to do, and for how long. I've seen this happen many times where the family's in the room and they'd say, well, Mom, you walked to the bathroom just fine. Everything's going to be fine when you get home. And, of course, the senior loved one agrees. But having that honest conversation with the therapists and the nurses and the discharge planners, again, really understanding how far can they walk? Are they really steady on their feet? Is that something we should encourage them to do? That's very important to understand and to really get the information not just from the senior themselves, but from the staff as well. Another tip is to make sure that the family understands the dietary concerns and restrictions. So important. It matters, and we've seen this time and time again, how nutrition can impact almost every topic we talk about in this webinar series. Nutrition plays a big role, and it's the same when we're talking about readmissions. We've talked about medications. We need to make sure families understand new medications, understand side effects, and understand the instructions. That the staff can help with that, a pharmacist can help with that, but really taking the time to understand these things is crucial. The other thing that when we're talking to families about discharge and how to help them prepare for discharges is talk about medical equipment that might be needed. Maybe even understanding and giving resources on where they can find medical equipment that might be helpful. And then I think another big one is planting the seeds, and I know this happens already, but when we're talking to families, we need to encourage them to be proactive about the follow-up care that is going to be required, even what warning signs to look for, and what when they're looking for those signs, what are triggers for problems and not problems, or maybe as they're understanding follow-up care, is more care needed? Does the family need more help? Maybe it's short-term help they need. Maybe it's more long-term. But this is really to understand the whole picture of what's going to happen when the senior gets home. It's vital for these families to really understand that. So, again, when you are talking to families, sometimes it might be good to even just have a checklist of some of these items. And I think a lot of you probably use checklists already. I just think they're so handy. But just covering some of these basic tips on a checklist, making sure they understand everything will go a long way. One of those things on the checklist could be so when you think about what they need to think about when they're going through a discharge process, now they understand it. The next step is sort of to take action and to execute on some of those things. So we talked a minute ago about maybe they need medical equipment. So a checklist might say purchase or rent medical equipment and schedule a delivery. When we talk about medicines, it's one thing for all of you social workers and discharge planners to say, the medication list has changed, let's go over it. But then even encourage them on a checklist sort of format to go to the pharmacy and talk to the pharmacist about it all as well. And then when we talked about follow-up care, immediate action a family could take is even start to schedule that follow-up care right then and there. Make the appointments while you're in the hospital for the next visit, so it's already on the radar. They might have to arrange for rides. So again, that could be another item on sort of a checklist. And then when the family caregiver, you think about everything that's happening in the hospital, but they probably need to do some prep work in the senior's home. They might need to make a trip to the store, stock up on healthy foods. They might need to rearrange some furniture or clean some areas out or do something, declutter the bathroom a little bit. I mean, there's a lot of things that families need to do. And again, I know when we do these series about family caregivers, we're all just trying to help them even more because we know how taxed they are. We know how stressful the situation is. So helping them understand, number one, what they need to be looking for, and then number two, providing some sort of a quick checklist or some sort of a schedule for them to make the transition home would be very, very helpful for our family caregivers. Now let's look at a few more tips that can help families be successful when their senior loved one leaves the hospital on the next slide. And this is more, on this next slide, is really about what's happened once they've left the hospital. So we know the first few days at home are the most critical. And this is when the family caregiver really needs to watch for warning signs. And I know I mention this tip a lot, but I do think it's a great idea, and we should encourage family caregivers to keep a record of a small little journal, a little notebook of what's happening at home. So maybe a daily record of medications taken, maybe a quick note about how much was eaten that day, activities that they needed help with. This information would be so helpful for the follow-up visits for the doctors and nurses and the therapists that come into the home. Just sort of keeping that little journal would be incredibly helpful. Now, during those first 30 days, it's again important that the senior keeps those follow-up doctor and rehab appointments. And in the first 30 days, that's where really ensuring that all the medication is taken properly. And this is when, if there's new medication or a new schedule, it might take a good 30 days to really get used to it. So during that first 30 days, really getting that medication schedule down would be very helpful. Okay, now we've talked a lot about why readmissions occur, which is important because it gives us a clue on how we can help families reduce or prevent readmissions. And I want to build on this for families, but I also want us to think about hospitalizations from a proactive perspective. So I'm just going to switch gears a little bit because I want us to talk about how we can help families prevent hospitalizations in the first place, which really goes hand in hand with preventing readmissions as well. So I want to get back to that research that I mentioned on the opening slide. And I want us to start with the market research that Home Instead Senior Care conducted on the next slide. I think you'll find that this information is really interesting. And again, it was with about 400 nurses in the United States and Canada who specialize in senior care. And the nurses that we talked to estimate that about half of senior hospitalizations can be prevented. That is a huge stat. It's a great stat because when we're talking to families, we can use that kind of information to say this is why some of these preventive measures we're going to talk about are so important. You can prevent a hospitalization period, at least half of the time. So this is why we share some of these stats with you as well so that you can share them with family caregivers. Now, nearly 100% of the nurses on the survey agree that a family's role in keeping seniors healthy and out of the hospital is just as important as the role played by healthcare professionals. So again, and I know that's why a lot of you are on this call today. Again, you know how important these family caregivers are, and you know how important their role is, and you know how stressed and how they could use extra support. So and it showed on this survey too that they're so important in this role in the readmissions and preventing hospitalizations. Now, the research also identified some common actions that put seniors in particular risk for going to the hospital. The most common was waiting too long to see the doctor. And I think this one applies to most of us. We are conditioned to not want to ask for help and only see the doctor if it's super serious. And when a society ages, though, this sort of unwritten rule or society rule, it really needs to be reevaluated when we're talking about seniors and aging. Seniors need to at least call the doctor or call the family member and have them call the doctor and explain some of the symptoms and let the professionals decide if it's necessary to be seen or not. And that's, again, the family caregiver can step in and really encourage their loved one to see the doctor in an effort to stay healthy. Now, there was another interesting data point on this survey, and it was that less than half of the seniors these nurses have seen, less than half of the seniors these nurses have seen do have family members that can serve as advocates for their care. So that's great, but that's not 100%. So again, encouraging seniors to get more help, encouraging neighbors and friends to step up might be, I'm sure it's a role a lot of you play by encouraging them to do those things. But it's a scary data point for me to think about. But I know that that's the case. I know not everybody has this family member. So as we talk through all of this stuff, anything that we mention on these webinars can be shared directly with the senior as well. So it's just great when they have a family caregiver advocate as well. So what are the most common actions that put seniors at risk of hospitalization? Let's look at these a little bit more in depth on the next slide. Again, the biggest culprit when it comes to a senior's risk of hospitalization is waiting too long to see the doctor. And so when we think about that, like why is a person waiting too long to see the doctor? And there's 3 reasons that surfaced in this research that we did. Number 1, the person may be unwilling to change ways, or number 2, they may be in denial of health issues, and maybe there's some apathy or lack of concern. Now, as an extreme rule follower myself, it's hard for me to understand why seniors would not follow doctor's orders. But sometimes those orders include major lifestyle changes and major changes and hard changes. So, for example, a person with COPD, the doctor may tell them obviously the doctor is going to tell them to stop smoking. Think about, I'm not a smoker, so I don't know, but I appreciate the people that I know that have stopped smoking in their life, how hard that was. And it wasn't just, okay, I'm going to go home and stop smoking. It's huge, and it's a huge lifestyle change. So when you think about why people are not following doctor's orders or why they're unwilling, to change, that it's a huge lifestyle change. I also think about, when you think about preventative measures and how people avoid those when doctors mention those types of things, and I go back to the chronic heart failure patient, lose some weight maybe as a preventative measure that's encouraged. But again, very difficult for somebody to just, okay, I'll go home and just completely change my lifestyle. So I get it now. The rule follower in me understands why people don't always follow the doctor's orders. But this is where we have to keep talking about the benefits of these preventative measures and really be encouraging those healthy habits throughout life and continue those through aging. Family caregivers play a huge role in the success of following doctor's orders and those preventative measures. But again, when we think about it, sometimes for us to just, I know we talk a lot about preventative measures on these calls, and so sometimes for us when we say things like, it'd be so much better if you would stop smoking or if you would eat better or exercise a little bit, if we have more than one reason might resonate with seniors and families more, or maybe some stories or some hard facts. So whatever it takes, we've got to figure out how to keep that message fresh about preventative measures and keep talking about it and keep saying it to these families and seniors. Now, another risk that can put seniors in risk for going back to the hospital or going to the hospital in the first place is, again, medications. We've talked about this when we talked about readmissions. Seniors who are on multiple medications can become easily confused because of medications. It could be they make them a little bit confused or a little bit spacey or whatever. But again, when there's so many medications, and it's just hard to keep it all straight sometimes. Again, we talked about medications when somebody has Alzheimer's or dementia. That is a really, really big issue, and it's really got to be carefully monitored and watched. And again, notice how medications, it's a theme in a lot of these topics that we go over in this webinar series because it's just so important. And it's important in this topic today in preventing hospitalizations in the first place and preventing readmissions. So what are some of the signs that a senior might not be following doctor's orders? Well, there are some clues that we can help family caregivers understand and look for. And sometimes, and we have to share these clues because, you know, families don't always live by or live with or live near their senior loved one. And so when they're not always around and monitoring, you know, very closely, there are some other clues that we're going to have to help family caregivers recognize. And one of those big clues is obviously a missed doctor's appointment. Now, I think one of the things about a missed doctor's appointment is encouraging family caregivers to talk to the doctor and the nurses, you know, call the staff ahead of time and, you know, mention that you're involved in the care and that you want to be kept up to date to things, sort of even saying if anything major happens or occurs, you call me. So if the senior misses the doctor's appointment, hopefully the family is called to say, you know what, your mom missed the appointment today, so on and so forth. So really getting getting to know the staff in the doctor's office would be big and a really good tip to share with family caregivers. Now, when you think about chronic conditions and them worsening, sometimes the signs are obvious, like a person who has COPD. Oxygen amounts are a good example or a good indicator of are things getting worse or better. But when you think about a person with arthritis, for example, it's hard to see stiffening arms and legs, and it's hard to see if the person is not following the doctor's orders to exercise to reduce that stiffening. So some signs that families can look for are maybe bruises, because maybe they've stumbled a little bit, so maybe some bruise on their arm, they've hit their arm because they stumbled on a little bit and ran into the chair, or maybe even a fall could be a sign that the chronic conditions are worsening and that the family needs to pay attention to these warning signs. I feel like all the time we're really teaching our family caregivers to look for these signs. We're kind of our group, all of us professionals, we're teaching them to be sort of detectives, I feel like sometimes. But it's so important for them to notice those subtle little signs. Another a sign for them to see is those unused pills. So checking the pill bottles, and if it's the 15th of the month, hopefully there's only half the pills left, kind of a deal. So really, again, it's easy for a senior to say, oh, I'm taking my pills. Yep, I took them all today. But really looking at those bottles just to make sure everything is going according to plan. And then I do want to talk about this apathy or the disinterest in overall health and mood. This is a sign. And maybe the person's not their usual self. Maybe there's some of those depressive symptoms. These are signs that the senior is not taking good care, and that it could be signs that they're not following the doctor's orders, again. And it just could be, again, a warning sign that something is different, something's changing, and need to pay attention and get on top of this and start to think about preventative measures. And speaking of preventative measures, let's start to look at those on the next slide. So what can our family caregivers do for preventative measures? Now, obviously, we've talked a lot about following doctor's orders, and we've talked about the signs, so I'm not going to cover those again. But the second tip, again, is those symptoms. I know that I don't know. But as a person ages, there's a lot of aches and pains. Could be sometimes there could be complaining. And I do think about my own family experience and my grandmother again. She did have some chronic, complaints about her health. And it was really hard because we heard about them all the time. But at the same time, we need to pay attention to those aches and pains or those subtle differences that that the senior is talking about. So maybe it's a simple little sign of their gait has changed. So maybe they're starting to shuffle a little bit more. Maybe their weight fluctuations could be another sign. Unsteadiness should not be ignored. Again, I go back to that little journal or a few pieces of paper just to write down some of those, what kind of happened today? Was there what they complained about, or was there an ache and pain that they talked to me about today? And how were they feeling? What was their mood like? Again, so helpful when you're going to talk to the healthcare professional. And it really is helpful to long-term understand what is something I need to pay attention to, or something that is just chronically the person, mentions and talks about. I think, you bring up those symptoms that the person, talks about a lot to the doctor, and the doctor reaches a point and says, there's nothing more we can do. That's just, I think of my grandma on her back. She's just 97 years old, and her back is just frail, and it's probably got some little cracks, and there's probably pain, but there's really nothing we can do except medication. So it's just one of those, okay, now we know what that symptom is, and we're not going to worry about it as much. We're still going to track it and pay attention, but it's just so it's something we can cross off the list, so to speak. So again, encouraging families to keep that record of that notebook is so important. Now, staying active is another huge preventative action. And you knew I was going to get to this today. I'm sure you all knew this one was coming, because you know how I feel about exercise and nutrition. And we're going to talk about that in a little bit. But Dr. Clevenger, again, the nurse who helped us with this research, she reported that one of her colleagues found that on average, older adults in the hospital are only out of bed for 30 minutes in a 24-hour period. And so we know that inactivity can lead to depression and lead to those worsening of chronic conditions. So again, understanding the signs of inactivity are very important, and that goes back to the walking and the balance and even mood, This time of year in the winter, it's a lot of us aren't as active as we usually are, I imagine, and your mood's different. So if you're inactive, that's another sign families can look for. Maintaining a healthy diet, another great preventative action. It really, when you think about nutrition, it really kind of dictates energy levels. So nutrition sometimes, to me, is the heart of the matter. If you're not eating well, you don't have a lot of energy and you don't feel good enough to be active or get out socially or do your normal daily activities. So a senior could be at risk for poor nutrition if they're unable to get to the grocery store, or maybe they don't have somebody to have a meal with them. We've done a lot of research around understanding that companionship at the mealtime, and it is so important. When people have companionship at mealtime, they eat better. That's the gist of the research. It's the bottom line, is they eat better and they live better. So encouraging families to look for ways to, maybe have a regular friend come over for a meal once a week, or having more family dinners, different things like that. And then, of course, Alzheimer's and dementia, if that is present, always at risk for maintaining nutrition. So we've talked a lot about that on other topics, but really making sure monitoring that nutrition when Alzheimer's and dementia are present is very, very important. Now, one of the biggest preventative measures to help keep seniors out of the hospital is to reduce their risk of falls and accidents. So on the next slide, let's talk a little bit about falls. And this is where I'm going to cover a little bit about environment and the exercise and nutrition that you're all waiting for. I know it. So according to the Centers for Disease Control, the CDC, 1 in 3 older adults over the age of 65 fall each year, but less than half will bring their accident to the attention of a healthcare provider, and I'm sure we can all guess why. And then when we look in Canada for some stats about falls, the Public Health Agency of Canada says that falls remain the leading cause of injury-related hospitalizations among Canadian seniors and contributed to approximately 85% of hospitalizations. And we know that a fall is a warning sign, and it should be considered a symptom of another issue. Now, when we talk about falls, we immediately go to environments, and we talk a lot about safety on these webinars. So I'm just going to briefly cover some of the tips that we should share with families again. Again, I know we talk about this a lot, but I think it's so important to just have a little bit ingrained so when you're talking to families, these tips come to mind right away. So it's, again, removing clutter from pathways and making the furniture arrangement so that it's easy to get through. There's nothing in the path, and it's easy to navigate. Removing or securing throw rugs. I never believed that was really a problem until I had my own battle with my grandmother of the throw rugs. It's a real issue. I've battled with several seniors on this one about how we've got to get rid of those throw rugs. So it is a real issue. Using the assistive devices, the cane or the walker, if that's what they use when they're on those uneven surfaces or unsure, if they're going out somewhere and they're unsure about the surface, it's okay to take some of those things in case. The non-slip shoes are important. Organizing house items so that the senior doesn't have to bend, reach, lift heavy things, climb ladders, all of those types of things. And then lighting is huge. We talk a lot about lighting. Got to have a lot of lights around, a night light, maybe light on in the bathroom at night, so reduce falls in the dark. And then handrails, just such a big one. Railings, handrails, grab bars, all of those devices so important to preventing falls. Let's go to the next slide and look at some additional ways that we can prevent falls. And we talked about environment, and I said it was coming. You knew it was coming. Exercise. And again, I don't want you to just take it from me about the importance of exercise, but the CDC also says that older adults can stay independent and reduce their chances of falling if they exercise regularly. We know that the lack of exercise can lead to weak legs, and that can increase the risk of falling. So it's important to look at exercises that improve leg strength and balance. This can be programs like a Tai Chi or water aerobics, but it could also be simple chair exercises, even just generally moving around. Encouraging families to have the seniors still do as much as they can and only assist as needed instead of doing everything for them. Just little things to keep them moving around and keeping them active. Again, medications. It comes up again here because it's important when we think about falls. We think about dizziness and drowsiness, some of those side effects of medications and some of the drug interactions. Monitoring medications, huge in preventing falls. And then we think about, as people just experience the natural aging process, they're going to have stiff joints. They're going to have poor eyesight or decreased eyesight. They're going to have decreased muscle strength. So things like getting the eyes checked on a regular basis, seeing the eye doctor once a year, just some of those tips, again, to remind families about the importance of eyesight. And again, I go back to exercise again and just moving around. We've talked a lot about those other preventative health measures. When we talked about preventing hospitalizations, it applies to preventing falls. So again, when you talk to families, here's one of those opportunities that you can make a double point, I call it. So you not only eating right not only helps you prevent hospitalizations, but it helps you prevent falls too, which we just said falls, are the biggest risk for people going into the hospital. So maybe that would help you make a point more clearly when you're talking to families about these things. Okay, let's look at resources on the next slide. I love to give you as many resources as I can possibly think of each month so that you can have some more tools in your toolbox. And these are just good resources for a lot of people. it's seniors themselves and family caregivers. And Caregiver Stress is always a website I use. Lots of articles to help family caregivers on this site. ReturningHome.com. This is a site with great articles about making that smooth transition from the hospital to home. It covers things about understanding how much care might be needed, creating a care plan, understanding insurance, tips for selecting medical equipment, all kinds of things on this site. It's a great website. The Senior Emergency Kit, I bring this one up a lot, and again, because medications are such a huge factor, I would encourage you to have families use that medication tracker, which is in that Senior Emergency Kit. It's downloadable. It's free. It's easy. It's a PDF document. It's an easy thing for them to go and use. Foodsforseniors.com. With nutrition being so important in a lot of these areas and preventing hospitalizations, this website talks about recipes. It has shopping tips, 12 essential food staples, all geared at the senior and an aging adult. And then PreventSeniorHospitalizations.com. This one I want to spend just a little bit more time on. This one has a great hospitalization risk meter for families. It's an interactive meter that they can really look at and understand what are the risks, where is my senior loved one at with a risk to a hospitalization. So there's it's a great little tool I encourage you to look at. But then on the next slide, here's a little bit more about this PreventSeniorHospitalizations.com. One of the things is that we worked with the University of Nebraska Medical Center, and we created some simple exercises as well as assessments for families to utilize. So there's some assessment videos, which basically are just a quick little assessment for a family to see where their senior loved one was at with their activity level. So one of them is an 8-foot up and go, where a senior sits in a chair and there's a cone 8 feet in front of them, and you time them from them to stand up, walk around the cone, and sit back down. It's just a little bit of an assessment that the University of Nebraska Medical Center uses and a lot of fitness professionals use to really get a gauge of where somebody's at with their fitness level. And then we've created 6 additional exercise videos. So it's a senior trainer actually demonstrating the video, in this video demonstrating the exercise with an actual senior, as well as a caregiver standing there showing how they could be a part of this and how they can assist if necessary. So this, as you talk to families about exercise and the importance of these preventative measures and the importance of exercising and staying active, we've got these great videos that you can send them to utilize. It just makes it a little less intimidating because, when you tell a family they need to exercise more, we need to give them something to go to and actually utilize for it to actually work. Okay, before we go to the phone lines, let's look at the last slide, and I just want to summarize briefly what we've covered today, because it seems like on these webinars we cover so much information. But basically, we started out by talking about readmissions and how to make the hospital-to-home transfer successful. We talked about what can lead to readmission, some of those drivers. Those include, the person not understanding their illness. We talked about medications being a big factor in that driver. We talked about how families not being present could be a driver to readmissions. And then understanding everything at discharge. Those are some of those things that we talked about that could drive readmissions. But then we also talked about how we can help families prevent hospitalizations or readmissions. And those, we first talked about the risks. So we talked about waiting too long to see the doctor. We talked about, again, mismanaging medications, not following doctor's orders, and skipping those preventative measures. And then we talked a lot about those preventative measures, which include, like the risks. It's the opposite of the risks. So follow doctor's orders and don't ignore symptoms and really monitor medications and maintain that healthy diet, and again, reduce falls and accidents by staying active physically and mentally. So thank you all so much for your time and attention today. We really appreciate it. I'm going to turn this back over to Steve to open up the phone lines for some questions.
All right. Thanks very much, Molly. Great presentation. As you can see, everyone, from the slide up on your screen, it's time for the Q&A portion, so send us in those questions. Molly, let's jump right into it here. First question for you. What if a senior or older adult does not have family or friends that can be involved in the discharge planning?
I think that's a tough one, and I always turn to, when I worked in that scenario, I turned a lot to our area offices on aging, and I looked for an ombudsman type of role or an advocate type of role or a social worker, a caseworker from one of those offices to help out and assist with that. And the other thing that I think we could do is really no family and friends. Is there, really talking to the senior about who else in their life do they rely on, and maybe having to reach out a little bit further. Maybe it's even, I've done this before, where it's been a power of attorney. One of my scenarios was exactly that. This woman had nobody, absolutely nobody, but we knew we had on file her living will, so we knew her orders and everything, and we said, well, we're going to call this attorney, and we're going to call this person who put this together and see what they know. So this is where you guys are going to have to be a little bit detectives to really try to dig in and find somebody that could help. But for my scenario, once we located the power of attorney, or the attorney who drew up this will, he actually ended up being the advocate for this woman, and he just kind of did it on the side. He wasn't a family member, but he just had been the attorney, and he knew the situation, so he was like, I'll do it. I'll be the advocate for this person. I'll be at the discharge. I'll help set up services, because this woman needed help when she left the hospital, so she did need to hire some home care and get physical therapy and those types of things in the room. So I think it's very hard. Like I said, I turn immediately to the area offices on aging. I look at those kind of resources in the community, and then after that, it just turns into sort of a detective work and really trying to figure out if there's anybody in this person's life that can help them out.
Okay, next question. I'm curious about the ways to prevent or prepare for depression when a senior returns from a hospital or a rehab, as that in itself can lead to new ailments that increase readmissions. If there's no preparation, what can be done when depression and anxiety settle in and the senior starts regressing?
That is a great question, and it's a great point to bring up, and I'm glad that you brought this up. I think you're exactly right. It's such a huge piece. When somebody goes home from the hospital, obviously you were just in the hospital, so you weren't feeling good. You probably still don't feel good. There's probably a bunch of changes happening, and you're probably going to be in a state of change for the next few weeks or days or however long. And you're right. We have to be able to not only think about the person physically, but what is this doing to their mood and their psyche. And I think some things that we can encourage families to do is communicate with their social network. So talk to their friends and families. Ask them to continue to send cards or make a phone call or drop in, let's set up a lunch. I think it's so important for families to continue to think about that. Another tip I would say is trying to think about the things that would make this person, look forward to something during the day or happy during the day. So if it's a grandchild visiting or maybe there's a favorite game they like to play or a TV show that's on, maybe it's, crossword puzzles, whatever it is, that's a great point. I'm glad somebody asked, because we really have to think about that. We got to sort of put in place. That should be a major part of the discharge process, is not only physically what's happening, but what can we do to make it successful, quote, mentally, and keeping the person happy and social and active. So I think that's great. I think there's just some basic things. I would include that if you're going to do a little checklist for families, I would definitely include that piece of how are you going to monitor their mood, how are you going to keep their spirits up, and really look for ways. Maybe it's as simple as a special ice cream or a special dinner, or, I mean, there's so many things you can think about on that one, but thanks for bringing that point up, and yes, it should absolutely be part of the process, of the discharge process.
Okay, another tough question here. What can a case manager do in the case of a client or patient being discharged from the hospital too soon due to the coverage limitations?
Wow, that is a really hard question, and that question makes me sad, and I know it happens. That's unfortunate that happens. I think that the case manager, that's such a tough role, and it's such a tough position to be in. And I think one of the things that they can do is to really, again, it might involve more of an in-depth discharge process, which I know then I think you guys don't have time for all of this because you've got a million cases as well. So you think about, are there ways? That's where maybe you do come up with some sort of a resource checklist or a place where they can go get, families can go get resources. This is where you really are working on your relationship skills with the family and really talking to them about everything a lot more in depth. I guess I don't have a good, quote, answer or silver bullet, or there's no easy answer to this question. It's absolutely unfortunate that it happens. I just think that the more information you know, the more resources you can give, the more you can prepare the family. At the end of the day, you know you did everything you could. That's what you've got to stand that's what you've got to do every day. And so when you think about these situations where that could occur, even if there's any additional follow-up, you could stay engaged in the process, checking in on the situation or getting updates from the therapist or whoever. So, I mean, another big one is awareness. Is obviously when a person goes home probably too early, they will have services still at home, whatever kind of service it could be. So really making sure that the team of people or the few like a therapist or whoever is going to go in, or a nurse, making sure they really understand the situation, that it's probably too soon, and more of the process. So maybe awareness and making sure everybody is aware is a good tip. But that's a tough one. I'm sorry I don't have a good concrete answer for that because it's so hard.
Okay, Molly, well, we have reached the end of our hour here today, and we're just about out of time, but I want to thank you for another great presentation and for being with us today.
Thank you, Stephen. Thanks, everybody, again, for coming on this month. We really appreciate it.